supplemental voiceover to help you complete your biofeedback study guide. The first video that I presented went over the first two principles on your study guide, so I'm going to skip down to the third one where it starts talking about electrodes. Electrodes, although EMG electrodes can be inserted into target muscles for precise measuring during research, surface electrodes will work well in rehab. The electrodes should be placed over the target muscle that we want to evaluate, and then individuals will be asked to contract that target muscle if we're trying to increase force production or relax the muscle if we're using biofeedback as a relaxation technique. The picture, let's see, I think I've got a picture here that we can look at. This is a pretty good picture of what biofeedback looks like. This is working with somebody with a post-op ACL. So we have electrodes picking up the the contraction of the VMO, and then at the anterior tib, and they're recording some data on this particular screen. But it gives the patient maybe some better auditory feedback, visual feedback as to how much the muscle is contracting. They can see that on the screen or hear it through the speakers of the computer. So back on our study guide, EMG biofeedback should initially be used with basic exercises such as quad sets and straight leg raises, like it was shown in that picture that we just saw. And then as rehab progresses, it can be applied during more functional exercises such as squatting, step-ups, leg extension, and leg press. And then as good neuromuscular control is demonstrated, the use of biofeedback is decreased or eliminated. Sometimes, though, we're working with somebody and they have trouble contracting a muscle, the biofeedback isn't really helping them get a sense of what's going on, so we may end up using the NMES, or neuromuscular electrical stim, can be used. And then once an active contraction is accomplished during neuromuscular stimulation, the EMG biofeedback can be reintroduced to facilitate restoration of neuromuscular control. So indications for biofeedback, the first one is to enhance muscle reeducation. So this is individuals who demonstrate an impaired control over isolated muscle contraction or during simple tasks like step-ups or mini squats. They're gradually decrease the biofeedback use then as their movements become more automatic and movement patterns are established. They must have good volitional control of a muscle in open chain activities or exercises before progressing into closed chain activities. Otherwise, they'll end up substituting with bigger and stronger muscles. And we'll talk about this some more in TI2 when we talk about exercise prescription. Then B, the other reason for using EMG is to enhance relaxation or inactivation in individuals needing assistance with tension management and stress response, or a particular muscle that is overfiring. For example, you'll see this oftentimes in the upper traps with somebody that's post-surgical with their shoulder. They'll tend to use their upper traps to elevate their shoulder rather than their deltoid or their supraspinatus. So we could hook up biofeedback on their upper trap, and the goal is that they keep the biofeedback quiet or subdued so it doesn't make any noise. Relaxation training works best with several feedback sources, including temperature, galvanic, skin response, and EMG. Additionally, thought stoppage, visual imagery, breathing exercises, and isolated muscle contraction and relaxation can be helpful. These are some techniques that you'll learn in TI3 for additional therapeutic interventions. Some advantages, there's three primary ones. The first one is that it's easy to use. You just put the electrodes on the muscles that you want to record what's going on with them and tell the patient what exercise that they should do. There's no contraindications really for biofeedback, although you wouldn't want to put it on somebody and ask them to contract their muscle if the muscle isn't supposed to have an active contraction taking place. And then the last one is that it requires active participation by the athlete, so it's not a passive modality. And whenever we have the patient involved in their rehab, it's more effective in compliance as well as results. There's an article that you can link into that I'm asking you to read and then discuss how biofeedback can help decrease patellofemoral pain symptoms. And there's a paragraph in that article that talks directly about that. And then it addresses several other conditions in which one could use biofeedback. So maybe write down 3 that we didn't talk about in this lecture, and probably if they're more applicable to physical therapy or rehab, that would be more helpful. And that's the conclusion of the lecture. Thanks.